class. Today we're going to be discussing telemedicine and accessibility of healthcare. This presentation has been brought to you in part by Ms. Chelsea Taylor, Ms. Ebony Ravenwell, and Ms. Mikkel Patterson. Hope you enjoy. Okay, so first we're going to start off by discussing one of the major problems that we're having in reference to telemedicine. One of the biggest issues that we're currently facing right now is patients having accessibility to their health care. So this includes things such as being able to access the provider, their prescriptions, health management within their home. Of course, this affects everyone of all ages and races. However, a lot of patients aren't aware that they have many resources available to get in touch with their provider, like sending emails or accessing things such as my chart or reaching their electronic health record. So what we're going to do is discuss in a little bit more detail further along the lines, the different benefits of telemedicine and how patients can actually access these services and how it's going to not only benefit them but the provider as well. So here we're going to give you a little bit more background information in reference to telemedicine. So telemedicine itself is the remote delivery of healthcare services and clinical information using telecommunications technology. So right now it's currently being used everywhere. So it's used in hospitals and most commonly specialty departments, home health agencies. Is actually being used within patients' home, private care practices, nursing homes, and workplaces as well. There are like technical devices, assistive technology, as well as professional healthcare services that aid and care for people from a distance. So we're actually able right now to talk to patients that we have out of countries using things as we were discussing previously, such as the My Chart, and it's so much easier for patients to like send emails to their providers, and so that they don't have to worry about making unnecessary appointments when they can just get some type of knowledge or assistance into the problems that they're having via online. Ironically, a lot of patients aren't aware how easily telemedicine fits into their day-to-day life. Things such as emails, text messages, phone and video calling to their providers. Nowadays everybody has smartphones, so things such as the sleep tracker and medication reminders and the on-demand doctors apps is also examples of telemedicine. We have like the heart monitors and the Fitbits that a lot of people are using nowadays, and the at-home blood pressure monitor. So all of this is what's really helping to generate the new concepts of patient care and how much is changing and how technology is really, really taking over the healthcare world and making it more advanced. So people are really adapting, and that's really a good thing. One of the most amazing things about telemedicine is the benefit it offers. So it offers things such as removing transportation hassles. It offers an easy way to monitor chronic healthcare conditions such as obesity, diabetes, and hypertension. Of course, it saves money. It provides safety and security monitoring for the home. It eliminates the need to multiple doctor visits, which of course ties into the saving money because patients aren't worried about paying co-pays, and they don't have to worry about transportation to their doctor's visits. It provides a better patient-provider interaction and communication, and it also grants easier access to healthcare records as well. And this is actually a little chart that really highlights the benefit of telemedicine. So if you see, we have things that are highlighted such as the higher quality of life, higher quality of care. Of course, it's more cost efficient. It encourages things such as disease management, encouraging patients to change their lifestyle. It causes reduced periods of hospitalization. So those are a lot of things to really take into account when we're referencing telemedicine. As far as accessibility is concerned, us as providers need to realize that we can really be the solution in reference to patients being able to access their care. Things such as education, a lot of patients aren't aware that they have the resources and the tools they need to talk to their providers. So we should really be educating them on how to send emails or using their electronic devices to communicate with their providers, or things such as viewing their own health records or different apps that they can use on their phone to keep up with their health. So that's one of the things that we can do on our end, is educate them so that they can, really utilize the resources that they have in front of them. So a lot of the positive factors in reference to telemedicine. So of course we have the incentives and reimbursement for the providers. A lot of people aren't aware that after the implementation of the Affordable Care Act, the use of telemedicine could provide quality health care at a lower cost for consumers. And unfortunately, we do have some negative aspects. Of course, there's going to be a lack of training because a lot of people still aren't well versed into the new advancements in technology and the ways that they can access the telemedicine, the lack of proper licensing guidelines for physicians' use of telemedicine, incompatible software systems, and things of that nature that'll come into play. But of course, as time goes on, those things can be fixed. So this kind of focuses on how the healthcare providers themselves feel about telemedicine. So a lot of them state that telemedicine will change the way the United States look at healthcare. I'm pretty sure a lot of us can agree. It creates an advantage with today's use of consumer-based devices such as the smartphones and tablets, which was mentioned earlier. It's a great advantage for reimbursement packages that coexist with the implementation of telemedicine. That's mainly for the providers as well. It improves physician ability to recall select details about patients with cases and things of that nature, and also allows patients and providers to communicate more effectively. The technologies involved. So these are kind of examples of how telemedicine is currently evolving. So things such as the live video conferencing, that's kind of like a FaceTime app. So what providers and patients are actually able to do is they're able to talk face to face using their smartphones or tablets or laptops to have that more personal interaction. And also we have which is called the remote patient monitoring. So that's kind of a collection of personal data that providers use within themselves. So if they need to send information to nurses or other providers and physicians, they have that ability to do that. So one of the most common forms of telemedicine is the at-home patient monitoring. So this is a device that resembles an iPad. It's used to monitor vital signs such as blood pressure, oxygen saturation, pulse rate, weight, glucose, temperature, fluid status, and PT time, all within the comfort of the patient's own home. So just in case the doctors needs an update on the patient, they don't have to worry about the patient coming into the center or things of that nature. It's like a little beeper that goes off to let the providers know if their rates are elevated or below standard measurements. The new advances in technology have immensely enhanced patient accessibility of healthcare. Aspects such as communication have greatly changed. Patients no longer have to go through unnecessary channels to access their doctor. They can use their mobile phones or tablets to send emails or messages directly to their provider. Nonetheless, patients are saving money as well. Not only does the use of telemedicine prevent costly doctor visits, it eliminates copays, additional out-of-pocket costs, and transportation costs. Home care monitoring devices also prevent unwanted hospital stays. Patients are able to be effectively monitored in the comfort of their own home, which has decreased hospital readmissions and has proven to be cost effective as well. Patients also have access to their electronic health records. With the use of mobile apps, patients can log in online and see any recent lab results, appointment notes, and prescriptions. This also helps to eliminate paper trails. So why is telemedicine so valuable? So for one, it increases access to healthcare, which is the most important. Telemedicine also provides healthcare outcomes. So patients diagnosed and treated earlier often have improved outcomes and there's less costly treatments. Patients with telehealth supported ICUs have reduced mortality rates, which is over 15 to 30%, which is awesome, and reduced complications in reference to hospital stays. So, as we discussed earlier, it also greatly reduces healthcare costs. Telemedicine also assists in addressing shortages and misdistributions of healthcare providers. It also helps to advance the environment, and it also improves organizational productivity. So employees can avoid absence from work due to family illness. They can now remotely participate in consultations about family members online. Home monitoring is reducing hospital stays by over 50%, and telemedicine has also reduced readmissions by over 20%. So before we wrap up, I just wanted to give you a little fun fact about telemedicine. So did you know that telemedicine retinopathy screening programs support early identification of serious eye disease and reduce the incidence of blindness in diabetic patients? Wow. So these are one of the many benefits of telemedicine. So as time progresses, we're really seeing how it's really benefiting the whole healthcare system, and hopefully we can see more advances in the use of telemedicine, and hopefully more providers are going to be willing to adapt to the changes as well. So this concludes our presentation. Thank you for watching, and I hope you enjoyed.